Skin cancer is one of the most common types of cancer, but it's also one of the most preventable and treatable if found early. Here's what you need to know about skin cancer. I'm Dr. Nina Desai, board-certified dermatologist and mom of 4. It's my goal to help you find solutions for your skincare concerns and share a little bit about my life. Don't forget to subscribe so you don't miss a video. So skin cancer occurs because of the abnormal growth of skin cells. There are many types of skin cancer, but let's talk about the most common types. So first, there's basal cell carcinoma. Basal cell carcinoma is the most common type of skin cancer. This one occurs on sun-exposed areas and tends to occur in the older population. Basal cell carcinomas grow slowly and they rarely spread. Typically what you're going to see on the skin is what is known as a pearly papule with blood vessels running through it, or telangiectasias. Oftentimes the skin is raw and doesn't heal in these areas. So whereas basal cell is slow growing, we always recommend treating it because it will continue to spread on the surface of the skin. And as it continues to spread, we do need to remove more of the skin in order to clear the cancer. So you want to catch it while it's small so that you don't have to undergo a large procedure to remove it. Second, we have squamous cell carcinoma. Squamous cell also occurs on sun-exposed areas, but this one is a little bit more aggressive. Squamous cell carcinoma can, if left untreated, spread to other parts of the body. Squamous cell carcinoma is usually red and scaly, and the skin can be raw or ulcerated as well. And lastly, let's talk about melanoma. Melanoma is the most dangerous type of skin cancer. Melanoma does not always occur on sun-exposed areas. There is a genetic component to melanoma as well. And melanoma, if left untreated, can spread to other parts of the body and can be deadly. So melanoma can be tricky to diagnose, and it can look different in different individuals. Melanoma can be dark and it can have irregular borders, but melanoma can also be colorless in something called amelanotic melanoma. So it's really important to make sure you're getting your skin checked to look for signs of changing moles. So what are the risk factors for skin cancer? First and foremost, UV exposure, especially in the skin cancers of basal cell and squamous cell. Along with that, fair skin. Those that have fair skin or red hair are more susceptible to skin cancer. Family history and genetics do play a role in the development of skin cancer. So whenever I do a skin check, I always take a family history. And I'll typically ask, does anyone in your family, whether a parent, a grandparent, or a sibling, have a history of skin cancer and which type? And lastly, immune system suppression. There are some medical conditions in which your immune system is suppressed, and that will lead to an increased risk for skin cancer. So how do we detect skin cancer? The basic rules of looking for a changing mole are what are known as the ABCDEs of a changing mole or skin cancer. A is something that's asymmetric. B, where the borders are jagged or irregular. C, color changes or more than one color occurring in the same mole. D, diameter, something growing larger and rapidly. Or E, evolution, something that has evolved or changed over time. And while I counsel my patients on the ABCDEs of skin cancer, if you find something that has one of these features, it doesn't necessarily mean that it is a skin cancer, but it does mean that you should have your board-certified dermatologist look at it and do a biopsy if necessary. So I also counsel my patients that it's very important to look at your own skin at home. I will have them do what are called self-skin exams every 1 to 2 months at home, looking for any changes on their skin. With my clients who have a history of basal cell or squamous cell carcinoma, I will see them for their skin checks every 6 months. For my clients who have a history of melanoma, we will see them more frequently every 3 months. Without a history of skin cancer, once a year is appropriate. So when I see someone in my office for a skin check, I have them get completely undressed and I will look at their skin in its entirety, including the scalp and including the private areas. I will also have them remove their nail polish before their appointment so that I can look at their nails. And that's because skin cancers can hide in the scalp or in your nails. Sometimes in our office, we use a small tool called a dermatoscope. That is like a magnifying glass that allows us to see certain features of a mole more closely. Now on the skin check, if we find something suspicious, we will do what's called a skin biopsy. A skin biopsy is a small piece of skin that's taken and then sent to the lab for analysis. This is not complete removal of the mole. This is for us to gather more information on what exactly is happening on the skin so we can decide if it needs to be removed in its entirety or if it doesn't. So now let's talk about treatment. We've had a biopsy done and it's come back as a diagnosis of skin cancer. So for individuals who have basal cell or squamous cell skin cancer, most often we're going to send for a specialized procedure called Mohs surgery. In this surgical procedure, the skin cancer can be removed in its entirety within that same day. What we'll do is we'll remove what we see, look at it under the microscope that very same day, and if we need to go back and take more, it will all be done at the same time before the stitches are put in and the skin is closed. Now, if someone has basal cell or squamous cell carcinoma and it's very superficial, or it's known as in situ, we may be able to use just topical chemotherapy to treat the lesion. For melanomas, it's very important to have surgical excision with appropriate margins based on the stage of the melanoma. For more advanced skin cancers and melanoma, we actually may need chemotherapy, radiation, or targeted immunotherapy. So one of the most important things about skin cancer is understanding the ways to prevent it. First and foremost, we really want to be good about our sun protection. Sun protection should be used from a very young age, and we have to remember to reapply. Most sun-induced skin cancers will develop slowly over time, so it's very important to develop habits early on in life to help protect your skin as we get older. Also, wearing protective clothing if you live in a very hot or sunny environment, or if you're outside for many hours a day, wearing long sleeves or long pants, sunglasses, a wide-brimmed hat, all of these can be very helpful in protecting your skin from sun damage. If you do have a history of skin cancer or a family history of skin cancer, or you live in a very sunny area, I urge you to seek shade during the hours of 10 a.m. and 4 p.m. where the UV rays are the strongest. It's important to understand that having 5 or more sunburns is going to increase your risk for developing melanoma later in life. And of course, make sure that you're coming in regularly for your skin checks so that if there is something that needs to be removed, it's found early and treated. And of course, avoid tanning beds. Using a tanning bed will significantly increase your risk for developing melanoma later in life. How are you protecting your skin from developing skin cancer? Share in the comments below. And don't forget to give this video a thumbs up and subscribe to my channel for more beauty and skincare videos.